Hi, this is Dr. Amanda Garcia, and today I'm going to be teaching you how to take your baby a bath when they're actually having an eczema flare-up. So first things first, you want to go ahead and get the bathtub ready and fill it up with lukewarm water. And the reason you want to use lukewarm water is because babies with eczema skin is very sensitive. So if you use water that is too warm or on the hotter side, then it's actually going to pull out the moisture that's already in their body. And this is going to contribute to their skin being dry. So we want to keep that moisture in as much as possible. So using that lukewarm water is not going to affect their body temperature as easily, and it will keep the moisture already in. So the next thing is that you also want to keep this bath pretty short. So 10 to 15 minutes max will be sufficient enough to do what you need to do. And again, the reason is to keep the moisture in as much as possible. The next thing that I want to point out is that the soap that you use needs to be a hypoallergenic soap, and you want to use something that is fragrance free, has minimal chemicals, and is as natural as possible. There's a lot of different brands out there. I will link them in the description box, the ones that I'll recommend, but there's a lot of different ones. There are a lot of different options you can choose from. But again, just make sure it says hypoallergenic and has the minimal level of chemicals and inside, because for babies with eczema, their skin is very sensitive and they tend to have an increased reaction to different chemicals. It's actually toxic to them, so their body's having a reaction and a hyper reaction to external chemicals that are being contacted within their skin, especially when they're taking a bath. Their pores are open and those chemicals are able to go inside even faster and a little bit deeper. So the soap that you use is extremely important. The next thing is you don't need to use like a wash rag or a loofah or anything like that. Just use your hands and just make sure they're clean, and then you just go ahead and gently wash their body as quickly as possible and as good as possible. Once you finish taking them a bath and washing their body, of course you're gonna rinse them off with the water, and then you take them out and you want to use an organic cotton towel. And when you dry their body, you want to make sure you pat dry their body and don't just kind of rub the water off. You want to gently just pat their skin as safely and as quickly as possible. You don't have to rush, but again, you just want to pat dry because you don't want to hurt their flare-ups that are already present on their body. It's a very sensitive area, so again, just be gentle. Once you're done doing that, it's extremely important that you then put on a really good cream, and this is more of an emollient cream. And the cream that we want to use, well, the reason that you use a cream versus a lotion is because a lotion is very thin and the creams are a lot thicker. So you want to definitely use a cream that's for eczema. Again, I'll link that as well. And the reason for this is because the cream, again, is a lot thicker, so it's going to lock the moisture in, and it's going to kind of be like a protective barrier and kind of like the gatekeeper of external toxins, external irritants. So things that do touch your baby's skin, they're not able to enter it as easy than if you don't have the cream on. So kind of think of it as a protective shield around the baby and their skin to prevent all the external irritants and toxins that we have in our air, in our environment, in the clothes, and touching other things get into their skin, and will help reduce the reactions and the flare-ups as much as possible, especially if they're already having a flare up now. It's going to kind of maintain it and help it to not get worse. So you want to make sure you do this. This is a crucial step, and you want to do this immediately after they take a bath. Don't wait like 10 or 15 minutes. After that, it's already too late. You want to just go ahead and do it right then and there before you put on their clothes. So one thing I forgot to mention is when you put on the cream, you want to kind of skip the parts that have the flare up. So example, if they have a big flare up on their elbow, you would put the cream all on their entire hand and then all above to the rest of their body. So kind of skip the areas that have the flare up with the dryness, the itchiness, the redness, the inflammation, okay? And it might be a little bit tedious, but the reason is because those areas need a special and a different topical cream. So most patients at the beginning stages of finding out their children have eczema are using steroid creams. If that's where you are at this part of your journey, then you would use a steroid topical. I'm gonna have a separate video about steroids. There are some side effects and they can be helpful and beneficial for some kids, but they are not beneficial and are not meant for long-term use. So that will be a separate video. So whatever you're using at this moment, then that's the cream you're gonna use on the actual flare-up site. So you can either use that or another topical cream. I'll actually link the products that I've used for my children, and my kids have actually, my son, my second child, his last flare-up was about 3 years ago, and then he just had another one recent a couple of weeks ago. So it had been a little while since I actually had to use these topical treatments, but so then I did have to do a little bit more research and kind of go back and to see what's new, what's working, what's beneficial, what are moms raving about and having good experiences with. So I did a lot of research to figure out what topicals that are new and working, and some of the oldies but still goodies. So I'm gonna link that in the description box for you guys. And again, whatever you're using, then you use that, and that will be on their spots slash flare-ups only. You don't want to put it on all over their body and all over the skin. It's specifically a spot treatment cream. This is a protocol I recommend to all of my patients when they're having an eczema flare. Now, it might take a couple of days or it might take a couple of weeks for the flares to completely be resolved, but you want to do this every day until they are completely gone and you no longer need to apply the spot treatment. So once the eczema flare-ups are completely gone, then you want to stop using this topical cream. Okay, you don't want to use it anymore until the next time you notice that they're starting to have a flare-up again. Remember, this is not for everyday use. What I do want you to do every day is to continue the exact same framework of their bath minus the spot cream. What you will do instead is use their thick cream, the emulant that I recommended, and put that all over their body. So you just put it on just like a normal topical lotion cream. But again, we want to stick to the thicker one because it's like a shield and a protective barrier to keep the chemicals out, reduce the irritants from coming in, and you want to also lock in and seal in the moisture as much as possible. Once you're done with that, you just dress them as you normally do. The only recommendation I do have is to try to use loose fit clothing, just because you want their skin to be able to breathe and for them to be as comfortable as possible. You can also try to use organic cotton or linen material is best for babies with eczema. One thing I've mentioned in previous videos is the importance of using a non-toxic laundry detergent. And something that a lot of parents usually forget about or don't realize is that when your child sleeps, they're sleeping in their bed for minimum 8 to 12 hours a night plus nap time. So they're spending a lot of time in their bed. Therefore, their bedding and their sheets also need to be washed in this non-toxic laundry detergent. And the reason why is because their skin is having a long period of time where they're having physical contact with their bedding, and sometimes the toxins stay in the fabric and then it can get transferred into their skin. So again, we want to eliminate the toxic exposure and the irritants as much as possible. So if your child is sleeping in your bed, then I also want you to make sure that you're washing your bedding with the non-toxic laundry as well. I hope this video helped, and if you have any questions, go ahead and leave them in the comment section. For those of you who are interested, I will also link a couple of products that I recommend for babies with eczema during bath time. And if you want to know more, and if you're interested in more tips on how to help your baby with eczema in a more natural and holistic way, then sign up for my monthly newsletter.